got to hear Rabbi Fox for a little bit before I had to hop off and do something else, and then Neila, and it was amazing. So, Yasher Koach, Karen, by the way. Well, welcome everybody.
Is your draft, Rabbi Fox, is yours going to be available later in the interwebs?
I believe so. Yeah, I think Don can answer for us at some point, but I believe all the Yom Kippur afternoon sessions are, if they're not already, going to be up.
As long as the moderator on them was hit record, then yes. We're posted everything.
Wonderful. Well, thank you everybody for making a little bit of time this morning to be with us. Those who are with us on Zoom, those who are watching on Facebook or on YouTube. And as we were just talking about before, those who are watching us tonight, tomorrow, or who knows when. As I'm fond of saying, everything that we're doing, everything that we're presenting is on demand after it is live. And so please, if you don't already, make sure that you follow the temple on whatever your social media platform of choice is, Facebook, Instagram, because that's the best way to be well aware and up to date of everything that so many of us who you see and so many of us you don't see on the backside are working so hard to create to keep us all engaged throughout all of this. I'm super excited today to have Gabrielle Kaufman with us from Maternal Mental Health Now, which I will confess is an organization that I know a little bit about through Lila Gurkis, who's the executive director of the Karsh Center, and through her predecessor, Liz Ross, who's a dear friend and was our founding director and very involved with Maternal Mental Health Now. And I think a really timely conversation for us to have, because I think many of us are aware now that we have settled into, going on 7 months of this surreal reality, and that, safer at home or stay at home is not stay at home for 2 weeks, but for, who knows how long. And I think even for the best of us, it can be taxing and put strains on our mental health and our relationships, and all the more so in the midst of parenthood. Many of you know, we have a 4-year-old daughter and we have a 3-month-old son. So we have I guess we're calling them pandemic babies in this. And, we're lucky and privileged to have plenty of help. And I have a remarkable wife who is a remarkable mother. And with all of that, there are definitely days when I think we're struggling to keep our sanity, to put it plainly. And it is certainly not easy under normal circumstances, but absolutely not easy under these circumstances, with so much, I think, of I'll channel my wife for a second particularly, but so much of the support that we at least remember having when our daughter was born, in terms of family being able to be around. Like my parents, they now have, but my parents didn't get to meet my son until he was 2.5, until a few weeks ago, really. They weren't at the bris. There was nobody at the bris. And my mother-in-law, wasn't around for the first few months anyway, to support my wife and to support us. And that's a big change in this whole reality. So really thrilled to have Gabrielle with us today to kind of explore some of these issues. So Gabrielle, thank you so much for being here. I'm gonna, maybe we can start with, kind of, for those of us who are less familiar, tell us about Maternal Mental Health Now, and kind of on the, pandemic aside, the amazing work you guys do.
Thank you. And it's always really an honor. I was very honored to be asked to talk with you all today. So Maternal Mental Health Now formed in 2007. At the time, it was called the Los Angeles County Perinatal Mental Health Task Force, which we felt was a bit of a cumbersome name. So eventually changed it. But it was formed by Kimberly Wong, who at the time was a public defender, who had battled a very difficult postpartum depression. Having a job that had insurance, having education, having a partner, having access to healthcare, and nobody could figure out what was wrong with her. And when she finally got better, she said, "This is ridiculous. I live in Los Angeles. I don't live out in the middle of nowhere. Something needs to happen. Something needs to change." So when she invited anyone she could, anyone she knew from both public, private sector, to come around the table. And of course, we ate empanadas, because we all know that if there's food around, we'll all show up, right? And we met together as a whole and said, how can we really work to make a difference? And at the time, I was running a program for a Jewish Family Service of Los Angeles, called the New Moms Connect program. And so I met kind of as a representative of JFS, coming together to really talk about what are the things that we can do. So early on, we decided that there were going to be 3 ways in which we were going to address the issue of perinatal mental health. Let me just define some terminology. We call it perinatal because we think of it as peri means surrounding and natal is birth. So the surrounding birth time, we think of the entire conception period, which also would include possible miscarriage, fertility treatments, during pregnancy and postpartum, and contrary to what the DSM says, which is the Diagnostical and Statistical Manual of Mental Health Disorders, we actually see disorders of this perinatal period lasting 1 to 2 years postpartum. And not to get too much into the weeds, but the way we went about addressing it was this 3-fold way. Number 1 is advocacy and awareness. If people were too afraid to talk about what was going on because stigma, we know that there's so much stigma when it comes to mental health issues, then people were never going to get the help that they needed. So we wanted to find partners to really help us to say, this is real, this impacts families, and we can do something about it. So that's number 1. Number 2 was developing an education arm, because it wasn't enough to say, here's an issue, but what are we going to do with individuals who are struggling? So that education arm was really meant to provide clinical training to healthcare professionals anywhere who would kind of come face to face with a family during this perinatal period, moms and dads who can struggle. And so to make sure that they had the awareness and capability to provide the treatment. So that includes physicians, family physicians, pediatricians, OBs, of course, even psychiatry, anybody to be able to get some idea of how to address these issues, because they are complex and they are different than other mental health disorders. As well, training social workers, anybody, MFTs, LPCCs, LCSWs, psychologists, so kind of in the mental health provision realm, and nurses, and even educators, anybody who might come into contact with families. We knew that if they were armed with some information already, people would be able to access services because those services would be informed. And then the third area through which we address perinatal mental health issues is legislation. So looking to make legislation that makes access possible. For example, last year, 2 bills came into effect. One that required screening be done during OB visits during pregnancy at least 1 time, screening for depression and anxiety, that had never been mandated before. And then the other is that there's new requirement that all hospital forward-facing staff that would work with these families, that all hospital members were to be trained with some, it could have been an hour of training on perinatal mental health, so that individuals were not falling through the gaps. Because this is what we find all the time, is that people are said, you go to your doctor and it's a couple of weeks postpartum, your 6-week postpartum visit, and the doctor would say to you, how you feeling? How you doing? Good to see you. And you say, I'm actually having a hard time. And some doctors might just say, that's just the baby blues, that's normal. And what we wanted to say was we needed to change that so that people could get the help that they need before they really fell into a place that was difficult to come out of. So that is the way in which we do this. We don't necessarily provide direct service. We provide consultation for clinicians. But during COVID, we have shifted our practices, and now we are offering online support groups to moms and dads who are struggling. So that was a very long-winded answer, but that is who we are as a nonprofit. We mostly serve LA County, but we do reach beyond in that way.
So can you talk about what pieces of that work has changed, since March in kind of this new reality, both maybe in terms, I imagine, kind of provision of services has obviously changed. And are you seeing changes in need and in demand?
Completely. So, well, first of all, just on a truly practical level, a lot of our trainings were happening in person. and everything is virtual. And I think in a way, this is kind of what we were talking about earlier, is that I think we may be more or less comfortable with this virtual format, but we have it, and it's important that we use it.
Mm-hmm.
But in terms of the issue of perinatal mental health, I know Rabbi Fox, you're also a mental health clinician. Mental health disorders have skyrocketed. Anxiety levels are through the roof. Depression is really high. And Rabbi Shapiro, you spoke to the idea of the isolation that has increased. And I like to discuss isolation as a steroid for depression. And especially in this postpartum period when our lives are already turned upside down. I mean, let's think about it. Day is night. We're all shifted. We're all upside down, especially with a parent coming home with a baby for the first time. They don't know what they're doing. And so opening your doors and saying, I need some help, whomever can come in, has been a resource that's been available in the past that is no longer as readily available. And an interesting thing that has skyrocketed with this too is guilt. Guilt is huge. So if I open the door, am I exposing my family to every person this person has come into contact with? So I've just noticed.
I'm smiling because it is as if you were eavesdropping on a number of conversations that happened in my house, both before our son was born, just in terms of, our own, our own kind of reality with our daughter, who wasn't obviously in school in the spring. And, if we let the nanny keep coming, then what does that mean? And who are we exposing it to? And what are we opening it to? And also just thinking, when our son was born in June, we spent a total, I think, of 21 hours at the hospital from check-in to discharge, which was actually fine for us. But I kept thinking, okay, we're fine. This is our second rodeo. I cannot imagine what this would be like for people having their first child. And I remember how we were, and people coming home with their first child and without the kind of, typical support structures and the typical kind of hospital experience where nurses are more attentive and you get an extra day or two to kind of get your feet under you. I just can't imagine.
Hospital policies have been changing hourly since COVID kind of hit, March, that time. There were policies that dads couldn't come in, that women had to go in and birth alone, or heaven forbid, you test positive, your baby could have been taken away from you. Policies have shifted since then. It's not happening, but thinking about that in terms of that early attachment relationship, and also the cortisol exposure to the baby, of the anxiety that mother was feeling at the moment. And, by the way, the dads are going through cortisol flood as well. And that creates this kind of very anxious bath for the entire family.
Yeah, absolutely. So how have you guys pivoted to sort of, either change what you're doing or to kind of address these new and greater needs?
So we've done it in multiple ways, but I wanted to point out that there's one other area I want to pay attention to, is that our sensitivity to caregivers. Caregivers are going through hell right now. We are living parallel lives, and I actually think of you as in the rabbinate as part of caregivers as well. What is being expected of you to show up as clergy for people who are suffering more is so much greater. And at the same time, you're facing those same challenges at home. So to that end, we used to do a monthly free consultation group, which is kind of like a support group for care providers. And we started to do it twice a month because we just found like monthly wasn't enough. And then we also used to bring in topics that were more related to the families we're serving. And then the topics more shifted in terms of how can we provide our own self-care so that we can continue to show up for the families that we serve. The second thing, and I mentioned that a moment ago, was that we are now providing online support groups. We weren't doing that before. We weren't doing direct service. We are providing support groups both in English and in Spanish. And I like to say we have people from Nebraska to Alaska joining us. Quite literally have had people from across the country come. And it's been so amazing to, I'm a clinician. So for me, this is exciting. I really often take the role in this position as more faculty member, but to be able to shift and to be able to do support groups has been very exciting. And I've really witnessed this beautiful camaraderie from people who really have only, given birth as their only thing in common, and find this way of saying, oh gosh, I feel this grief too. I'm so far from my family. I'm really struggling with the guilt that I let someone come into my home, or I'm really struggling with the great anxiety that I am feeling now that I've never felt before. And the friendship that people have been providing each other is really beautiful to witness.
So what do you see kind of as the horizon for this, or for the future? What are the next 6 months do you think look like? Not necessarily obvious for COVID and the pandemic, and no one has a crystal ball, but for you guys and the work you're doing.
Well, I think there are, I always hate the words silver lining, but I'm going to use it because I can't come up with anything better. But there is this kind of awakening to the fact that, we are as humans quite adaptable. So as much as I'm wrestling with the fact that I so much would prefer to sit in the same room with you, we're making this work anyways, and maybe more people will eventually have an opportunity to join because they couldn't have joined because, I don't know, they were at work during this time. So if we can use this adaptability to our benefit, we can shift in, we can take advantage of it, and we can continue to provide the resources in much more virtual ways. The other silver lining I think about is the stigma related to mental health, particularly at this time in people's lives, because we know that having a baby is universally the happiest time of our lives. If we can take a shift and say transitions are hard no matter what they are, transitions have this potential to put us in a very uncomfortable place, even possibly kind of this adjustment disorder struggle, and particularly at a time when we're greatly stressed, we might be able to reduce the stigma of mental health, and more people are coming forward. And I have noticed that conversations, people are much more using anxiety and depression in common language without feeling stigmatized by it. I don't know if that's what you've witnessed, but that's definitely what I.
Yeah, absolutely. Do you think that is because it's so, particularly in the anxiety, side of the equation, because it's so widespread? I think most of us, that are at least the least bit observant, I think just are probably aware of our own anxieties, and just that of everyone we seem to come into contact with these days, because everything is so unknown and so unpredictable, and that it's more expected and acceptable.
I think it's more relatable too. Mm-hmm. So I have a private practice as well, and I work a lot with women with postpartum obsessive compulsive disorder. And I have several clients who have contagion OCD. So let me just tell you what contagion OCD looked like for these people. They would be afraid to go in public and touch anything because they thought they might get ill from that. No time in history have people been able to relate to what OCD was like before. So somebody who'd never had any access to the understanding of OCD would say, well, just touch it. What's the big deal? Go wash your hands afterwards. Now we have so much greater access to understanding what OCD really is like. I mean, it's such an interesting thing. Now, the hard part is somebody with contagion OCD, you might be able to help them with an exposure response prevention kind of approach. And now it's so much harder. But I think this sense of greater compassion will always serve us in humanity.
Yeah, it's a very good point. The compassion comes from the ability to relate to another's experience, and that, many of us are now anxious about a shared experience in a way that certainly, I think, increases that relatability. I want to go back to your comment, sort of half joking, from Nebraska to Alaska with this direct service that you guys have moved into. Mm-hmm. Do you think that do you think that the virtual support group, which, as you said, you prefer to have somebody in the room with you? We all would, absolutely, I think. But does the virtual support group lower the barrier or lower the hurdle for participation because of the maybe added sense of not anonymity, but it's not putting yourself out there in the same way that being physically present in a room with, at least in the beginning, strangers is?
Absolutely. It gives you a little bit, I mean, yes. It also helps you to feel, I don't have to get there. You know, getting out the door with a newborn baby is very difficult. Getting out the door, we've been working both with pregnant and postpartum women. Getting out the door when you're, 38 weeks pregnant can be really challenging. So that barrier to attendance is gone. But, you mentioned this idea of anonymity, and it is really nice to say, I'm in Vegas and I'm joining this group, and no one in Vegas has to know. I can't help but saying what stays in Vegas happens in Vegas stays. Okay. But really that sense of like, I can attend, I can be here and I can be present and I can be real, and nobody's going to tell my neighbors. Nobody's going to see me, going underneath, the awning that says therapy, right? I'm just going online, and we're all going online for everything these days. So yes, for sure.
It's funny, that makes me think of, which is germane to our conversation, I think, a little off topic perhaps, but just you were talking about stigmas around mental health. And I think that, I think that's something that those of us in Southern California and on the west side of Los Angeles sometimes forget about, because, right, we live in a place where you're not in therapy, what's wrong with you, right? As opposed to large swaths of the country, the majority of the places where there are still kind of many stigmas around, seeking mental health support. So do you imagine, in whatever post-COVID world comes our way and whatever that looks like, do you imagine the idea of virtual support groups, continuing?
I do. And telehealth in general, I do believe will continue. It's a more affordable way to provide. I mean, I'm seeing all my clients this way. I know a lot of therapists have given up their offices. And it's accessible. It allows people who are in more remote regions, even if we say the Antelope Valley, which isn't so far from here, finding a clinician that you can go to is really hard. We train home visitors, and the home visitors are now doing e-visits too, because nobody's going into homes right now. I also think it's taken a little opportunity to do outside, to do a little more in nature. I was talking to a friend of mine who's a psychiatrist, and he said that he bought his soccer chair, and he goes to this park and he meets some of his patients in the park with their soccer chairs. And I kind of love that idea of it, because I think it's stigma reducing, it's normalizing, and it's also saying we can get what we need. We just need to be creative about how we get it.
Yeah, that's a really good point, I think, of creativity, that in many ways, look, so much creativity has been birthed by this experience. And we look at across many different sectors, finding new and innovative ways to do things. I mean, if you had told me a year ago that I would have sat, yesterday on my couch and had Yom Kippur, I would have told you were out of your mind. And, hundreds, if not thousands of synagogues across the country, if not world, did just that yesterday.
Yeah.
Since direct service is new, do you imagine potentially doing in-person support groups whenever that becomes a viable option?
So in a way, the way we had done it before, this goes to Karsh really, is we did it more in partnership with other organizations. I mean, the nice thing about us not necessarily providing it is that we are actually enhancing the services of programs throughout LA County, and being able to say, okay, somebody at Karsh is going to be now running this group, but we will supervise, we will train, we will kind of help with referrals and everything, but you can continue to do what you do best, and we will just be a kind of a a backbone support for you. In terms of like providing the group, we'll do it as long as necessary. And I get a kick out of it. I'm really enjoying it because I know it's making a difference to, it's having, in lieu of having a physical place, we have a virtual place. And what is it? Makom? What is it? Is that the word for place?
Yes.
So it's kind of, my Hebrew sucks. So, but that sense of this is a home that we can provide for people.
Your Hebrew is good enough, and you have two rabbis here.
I was hoping you'd take it from there.
Right. The last but not least, maybe, and then we'll see if Karen or Merle, if anybody on Facebook can. If you're on Facebook and you have a question, you can drop it in the chat, not in the chat, in the comments section, and we'll pick that up. What's the biggest challenge you guys face, and besides funding and finances, because that's always the easy answer, I think. But what's the biggest challenge and obstacle you guys face?
It's interesting. You mentioned that here, West Side Jews were comfortable with therapy. I don't know if that's true. And so I would say, even though I started specifically in this field probably 15 years ago, really focusing on this period of time, I've seen dramatic changes. I still hear fear, discomfort, worry about judgment, particularly in communities of color. I love having clergy who understands mental health, but I want to say that's more the exception than the rule. So I really think that I would still say stigma stands out. The nice thing is I think we've made some traction. The good news about COVID is maybe we've made even greater traction. We still got a long way to go.
So Karen dropped in the chat, I think, a great question, which is she's been asked to do a virtual support group for young rabbis who are parents, and wondering what you think some of the biggest issues are. Oh, I can think of a long list. But
well, so I would go back to what I said earlier. Rabbis are frontline workers. And I think with that sensitivity to that and understanding that we are juggling two realities, I have to do my very best to be here for you and your needs. And at the same time, I'm coming home to a kid I got to get on Zoom who's dying here because, he started high school 3 inches from his bed. And navigating those challenges. I have a family member who I can't see because they're in a nursing home. And that aches and hurts. And at the same time, I have congregants who have lost work and cannot find their jobs. And they cannot figure out how to take that next step forward. Or congregants who are ill and I can't visit in the hospital like I used to.
Yeah, that's such a salient point, because I remember, and now it's sort of become infamous, I think it was March 10th. Or 11th, what we didn't know at the time was going to be the last in-person clergy meeting we had as a team on a Thursday morning. And Corey Winter, our director of safety and security, was there and said that. He said, "This is probably the last time you guys are going to meet like this." And we kind of brushed it off. And he said, and he and I recently spoke about this, he said, without really understanding how right he was going to be, he said, "I think you guys are going to have to wrap your heads around and get comfortable, deathbed kind of rituals on FaceTime." Mm-hmm. And he was painfully right. And it's a very strange experience. And it's just, the Zoom funeral, the Zoom Shiva is a strange experience.
And I've been to them, but I've never had to officiate one. I can only imagine how hard it is. Yeah. Rabbi Fox, was there something, did that help? Was there something?
It does. The other thing that I'm hearing, both from some literature I've read in the New York Times about parents and who is the parent that's working with the kids, and of course it's the woman. And then the women are very concerned about the success of their jobs and holding on to their position at this point. And what suggestions might you have, Gabriella, in terms of dealing with that? I don't know if it's a marital issue or is it an economic issue? Or is it just we're back at instinct that kind of creeps in? And this group of people are, I'd say they've been around by anywhere between 3 to 10 years. And so the balance, and their spouses are not necessarily clergy. So the male-female thing is coming into this at this point. Thoughts, comments, suggestions?
Well, first of all, they're very lucky to have you, to have that opportunity. And I think it will be a very important experience for them to know that they have their own makom. There you go. So I brought that up again. The other thing that I will say, I have so many things you talked about. First of all, I want to channel RBG for a moment and say, well, yeah, this is not just about economics or instinct. This is about equity. And we are dealing with issues of equity now. We are facing this sense that we may, as women, have moved forward economically. We may have moved forward kind of in roles outside of the home. But I find this again and again too, with people who, when they have their baby too, traditional roles are very steeped in American society. So we kind of fall into those roles anyways. We talk a little bit about this kind of emotional load. Have you heard about this emotional burden that women often carry? So it's not simply that their partners may not step up, because we know that partners are really stepping up, but it's almost that sense of I have to tell you what I need you to step up to do, rather than it kind of coming out from you. So I'm bearing the burden to remind you to do these things. And that's a lot. I don't know how many of you have been in meetings or classes or whatever it is, and you see the children popping in, coming in. I just did a session with somebody a moment ago, and, here she is really bearing her soul to me, and you hear, mommy, right? It's so if I were to say there is a theme for everybody right now, for us as providers and for individuals in their homes, is lower your expectations. Really kind of come to the table knowing that we're at unprecedented times, and our goal is not perfect. Our goal is good enough.
And good is good enough. In other words, good enough is still good.
Good enough is still good. And you know what? Mediocre is good enough too, because you made it through the day. And I think this is this sense, and by the way, I got to practice what I preach a little bit. It's hard. It's hard to say, because I think, especially, I'm sure the clergy that you are going to be working with hold themselves to incredibly high standards. And it's this sense of you have a right to say my standards can lower a little bit, because it's not that I'm not doing as well. It's that I'm doing so much more. So you cannot be 100% at everything.
Mm-hmm. Mm-hmm.
I think, Karen, what comes to my mind also is this idea that has come up for me in many different things in this pandemic, which is that I think this whole experience doesn't really change reality for people so much as it just heightens it. It doesn't change who someone is and how they deal with things. It just magnifies it, right? And I think that so it also magnifies, I think, so many of the challenges and questions around clergy as parents and their families that were already there, right? For example, I think about it's always been an issue in terms of, for a clergy person, showing up for your family versus showing up for other people's families, right? And that negotiation and balance, and not being present enough for your own family and your own children, because you are for other people. And I think that's even more so now because the boundary is in a way gone. Yes. Because I'm sitting here working, the boundary's gone, and it continues, at least in our house, to be a negotiation between, we're 6 months in, But our 4-year-old, she's still like, daddy's at home, but daddy's at work is still a very, and yes, to your point, Gabrielle, I mean, yeah, like the first week I was very strict with like, honey, and the door's closed in the study, you can't come in. And now funeral intake, wedding meeting, she's met every couple whose wedding I'm doing in the next 6, because I can't. But I think that idea of just how present you are for your own family, even if you're home, is just heightened because you're there for others. And I think it's, I think so many of just the perennial challenges for clergy as parents, I think, are just magnified in so many ways.
What we have in a work environment is that separation between home and actual work. And here, because it's porous, it means that that what's going on is also shown on the screen, whether it's the client with their child coming in, or whether it's the rabbi with their kids coming in, or the lawyer trying to get to mediation.
Yep.
And
I'll just speak personally. I think that, not that rabbis ever had 9-to-5 jobs, but I think for whatever reason, willingness, and I own it as my own and many others, to sort of take meetings at hours that ordinarily I would never have in the office, but to take a 7 o'clock or meeting because, well, after dinner, I can hop on Zoom for a half or whatever. I think that's all kind of part of it too.
But it's a slippery slope. And I think that's, it's interesting because there's this normalizing effect of I've had a lot of clients who start out, my clients don't generally know much about me. And they start out the session, they say, no, really, Gabrielle, how are you doing? And, part of me like, how do you know? But of course they know because I live in the same world that they live in.
Right.
Which I think is why having some boundaries is necessary. And even, you said the word porous. Those boundaries may be more porous, and maybe you're going to take a meeting at a time you never did. But then I think it's really essential to be strict and say, okay, but Thursday's my day off, and I am not answering calls on Thursday.
Mm-hmm. Mm-hmm.
Whatever those boundaries are, to have some parameters to it, because it will take over.
Or even sort of 5 to 7, mm-hmm. which is sort of the witching hour with children.
Yeah.
And can you take that time off and put it in a schedule, and I'll be back on at 8.
Right.
For 8 to 9:30 for meeting or teaching or support.
Well, and the benefit, at least I've experienced, and so has my wife in her work and her practice, is that that's much easier to do, to block off those 2 hours or what have you, because I don't have to block out travel time and sitting in rush hour traffic, right? It's not, I'm done at the office at 5 and then it's, 7 miles, but 45 minutes to get home, right? And then back, it's walk into the living room and then 2 hours later, so I think there's a flexibility as a benefit to working from home that we're all experiencing, to be able to kind of carve out that time.
And the scales of that too it's amazing. Your day can truly be shorter, yes. But there's also that transition time. I really believe in transition time. So when you're driving to work and you're drinking your coffee and you're listening to NPR, you got your ritual going. And we don't have that anymore. So your drive to work, you open the door and you're there, right? So it's gone. And that's a loss too. And, Pauline Boss talks about the word loss. Now it just slipped out of my brain. But this idea of loss that we can't really, ambiguous loss. Thank you. Slipped out of my brain. Look it up. It's great. But she talks about ambiguous loss as the sense of grief that we have for something that doesn't feel as tangible. So, for example, a prisoner of war feels like a death to us, but they still may be alive, but we don't know. But the ambiguous loss that also comes from, I have lost my transition time that really helped me frame my day, that compounds. And I've noticed that as well at this time. This time there's been so many, the ambiguous loss of sitting at, you're going to have a sukkah and you're not going to have anybody come in. That feels downright not Jewish, right?
Right.
So how do you navigate? And that's an ambiguous loss.
that highlights, and I'm thinking of so many things, the commute is one of them, right? You hate sitting in traffic, but there's also a ritual to it, and it's time to decompress and NPR and all of it. But I'm thinking of how many of those kinds of things there are, the 5 or 10 minutes of just kind of schmoozing before the meeting starts because you're all sitting in the room. And sometimes that kind of happens on Zoom, but not really. It's not. There was a whole piece last week, Jamie Dimon, the CEO of JP Morgan Chase, talking about how he doesn't think that remote working is actually sustainable long term, because so much of what engenders, at least in their company, creativity are in these kind of informal, unstructured moments of senior executives mentoring, junior people, of the creative ideas that don't happen in the boardroom, they happen over lunch, or they happen, in the 10-minute break, or while you're waiting for the meeting to start, or right after the meeting ends, and that doesn't happen in this space. And those as you just beautifully illustrated, I think, and I hadn't thought of, are these kind of, amorphous, ambiguous, things that we don't think about as the real loss, but are huge losses to us.
The loss. The other thing I'm hearing is the stress in the couples of being in the same space for this condensed time, and particularly with families with very young kids, of the couples having no time. Any thoughts on that, Gabriella, in terms of how to approach it?
And I think this is why it just needs to be approached too, in that sense of lowering our standards of parenting too. Again, not saying we need to get into abusive places, but I don't need to entertain my child in the same Montessori way I used to feel was necessary. I can say with them, you know what, I got a phone call. I'm not happy about it, but here's the iPad. I think we used to be so frowned upon to do that, but we have limited capacity, and this is about lowering the standards. An interesting thing is DCFS reports are down, but they're not down because incidents are down. They're down because kids aren't going to school and teachers aren't making reports. And I think that homes are incredibly difficult in a general sense, when, kind of like
and DV reports are up.
They're up significantly.
Way up.
So we have to look at the tensions that are happening at home, and how can we find ways to say, forgive yourself if your son was on the iPad today when you never wanted him to be. Forgive yourself that you, made macaroni and cheese for the 5th night in a row. Like, how can we really reduce our expectations of where we used to think that we can, the standards we used to be able to uphold.
It's very helpful.
And that might actually, by the way, be a wonderful adaptation. Like, wouldn't it be great if COVID ended and we still were kind to ourselves? That'd be nice.
Well, Gabrielle, thank you so much. This has been just a really wonderful conversation, and hopefully the first of many. Thank you for just the amazing work you're doing out in the world and helping us do it, Karsh. I know it means a lot to all of us. And thank you for being so generous with your time today.
Absolutely. And it's so nice to see you both.
Thank you. Nice to see
Likewise.
you. Thanks for doing this.
Yeah, it's been great. Shana Tova.
Shana Tova. Thanks everybody for joining us. Hopefully you'll join us next week. Have a wonderful rest of your Tuesday.
Okay. Bye.